How are you?
Good, man. How you doing?
Not too bad. It's been a while since I've done these.
Dude, how was the journey?
Quite interesting. Haven't been this far west before, so
Oh, man,
glad to be here.
it's a little warm out here right now.
Warmer than Georgia.
Well, it's good to see you, brother.
Good. Well, better question is, are you ready for your 73 questions?
Dude, you know I am. I love this stuff.
Alrighty. Well, let's get started. So, what is your name
My name is Ricky Brown,
and your specialty?
plastic and reconstructive surgery.
And how many years have you been practicing?
I've been in private practice for 13 years. It's crazy.
Oh man, all well earned.
Oh, yeah.
So, where did you go to undergrad?
So I split my undergrad between Syracuse University for 2 years, my freshman and sophomore year, and then I transferred back to the University of Georgia. Go Dogs, baby.
Go Dogs, indeed. And where did you go to medical school?
I went to the Chicago Medical School, which is in North Chicago.
And did you take any gap years before going to med school?
You know, interestingly, I had to take a gap year. So I was 27 when I applied to medical school. And so when I decided at Georgia, my last year of college, that I wanted to go into medicine, I took all the pre-med classes and took the MCAT and applied. And because of that, I had a year of just waiting to hear from schools. So I actually took a year off and I worked in the operating room, which was really where I kind of fell in love with surgery.
Now, kind of speaking of what you fell in love with, what was your favorite part of medical school?
My favorite part of medical school, I would have to say that for sure, this is probably a common answer, but the relationships that I built there, the camaraderie, obviously the education, but I would say my favorite part are probably all the great friends that I met when I was there.
Yeah. So, what specialty did you think you were going to go into on your first day of medical school?
Oh man, this is an easy one for me, right? So because of working in the operating room, I was an orderly and I mopped floors, cleaning beds. I found myself kind of ducking into the operating room and watching surgeries. And so I really started to develop a love for surgery just from working in the operating room. So when I went to med school, I knew that I was going to have an open mind about just give everything a chance. But I had a pretty good idea after spending a year in the operating room that year that I was going to be doing something in surgery. I just didn't know what it was going to be.
Gotcha. Now, were there any specialties you said immediately out the gate, not for me?
Well, you know the surgeon's answer to this question.
Anything medicine?
Primary care, baby. No, so I think I honestly, when I started med school, my attitude was definitely, hey, listen, give everything a shot. But as I started to do stuff like medicine and family practice, which are super, obviously very important specialties, I'm just like a handsy guy, and I knew that like from the get-go that probably something in the primary care realm wasn't going to be something that I was going to do.
Gotcha. Now, specifically, what first made you fall in love with plastic surgery?
So I am double boarded, so I did general surgery first. So I completed a full 6 years. When I was in general surgery, doing a lot of trauma, level 1 kind of gunshot, knife and gun club, I call it, in Chicago at Mount Sinai, they would send their residents over to us to get their experience. And so the plastics residents would come over and some of their general surgery residents would come over. And so I started to sort of develop this interest in plastic surgery, number one, from those guys kind of getting in my ear and talking about plastic surgery. But number two, we had gunshot victims that would have some pretty severely deforming injuries, bellies that we couldn't close because of swelling. And the plastics guys would kind of swoop into our inner city hospitals to do these closures and fix things. And that's where I kind of started to develop this, all right, I'm in general surgery, but like, I'm kind of digging this reconstructive stuff and putting people back together. And that's really where I kind of started to develop my love for plastic surgery for sure.
That's a really cool story.
Yeah.
So
it was crazy.
Plastic surgery is a very much sought after specialty.
Yeah.
So for those who are interested, can you tell them how long does your training take after medical school?
So after medical school, there's a couple of different ways that you can get into plastic surgery. So there's two main paths. Either you complete a residency like I did, because my co-resident in plastic surgery was an orthopedics trained guy, and he decided part of the way through that he wanted to do plastics, so he finished ortho. So if you do a residency like that, for me, general surgery was 5 years. I did a year of research, and then it was a 2-year fellowship. And as you know, today, some people can do the combined programs where they get in right out of medical school, and it's 3 and 3. So I went the traditional path. For me, it was 5 and 2, but I did a year of research, so it was 8.
Gotcha. So
8 long years.
8 worth years.
That's
So,
right.
are there any subspecialties that take us long for post-med training? Because 8 years is quite some time.
Yeah, I think there's probably some fields in radiology when they do radiology, then maybe go into interventional that could easily end up being that long because radiology is several years. Plus, if you do interventional, it's a couple more years or another year. So pretty close, I bet.
Okay. So, any other surgical specialties that take that long?
Um, I think neurosurgery is pretty darn close.
Gotcha.
Yeah, I think they are pretty close.
Did you ever think about getting other degrees like an MBA or an MPH at all?
Man, that's a great question. I actually, at one point when I finished my medical training, thought that getting my MBA would be something good because I knew that I was going to go into private practice. And of course, when you go out into private practice, you got to run a business too. So I thought about getting my MBA, but because I have such a heavy business family, I decided, nah, I'm just going to stick with where I am because I was almost 40 when I got out of med school, or actually, I was 39 when I finished my training. So at that time, if I had gone forward to do more, it would have been way too long for me. I needed to start making some money to pay off my loans.
Understandable. Now, one of my favorite questions, what would you say is the most unique part of your specialty?
Well, hold on. Let me kick back for a second.
The joys of having your own office.
Hey, man, you're getting the feel of what it's like to be a patient. So wait, ask that again.
What would you say is the most unique part of your specialty?
I think one of the most unique parts of the specialty is the idea that we don't just treat kids. We can treat young people, older people. You can do reconstructive work. You can do cosmetic work. That's really what drew me into plastic surgery at the end of the day, was that it's so diverse. There's so many different angles you can go to within our specialty. You could do pediatrics. You could do cleft lip, cleft palate specialty, craniofacial, or if you just want to be a cosmetic surgeon and that's what your thing is, you could do that too. So for me, I think what grabbed me was the diversity of how many different things that you had to be good at. It's kind of like mastering a lot of things, and I loved the ability to be able to do that in this specialty for sure.
Of course. And this is the clinic part, so
yes.
What about the OR part?
Oh man, I love the surgery room. That's the OR is like the favorite place for every surgeon. That is our theater. We all joke that why do we have to go to clinic? I mean, I love talking to patients and I truly enjoy that. It's something I feel like I'm good at. But the OR is like my favorite place. I love it.
Yeah, so I think we should show them a little sneak peek into what it's like to be in the OR then.
Let's go do that, bud. Welcome to the theater. Hey, we're going to show you the OR. We're getting set up for a case tomorrow, but while we're doing that, let's answer a few more questions.
Absolutely. So I always love this question because I let the doctors sell their specialty kind of like a car salesman. So why should someone choose plastic surgery?
Oh, man. So, when I was deciding what I wanted to do, the first reason I think that you should choose plastic surgery, that I think it's a great field, right, because it's different for everybody, is I love the diversity of the field, but lifestyle was an issue for me. And I'm not just talking about making money. I mean lifestyle of how busy I thought I was going to be at the end of the day and being able to get home to my kids. And I think one of the things that I love about plastic surgery is you don't have to take a ton of call if you don't want to. And so the versatility to be able to sort of manage my day and plan that out is great. And then the other thing, like I said, is what I love about plastics that I think is really attractive for a lot of people. It's just the versatility of the specialty is you could just do so much from the reconstructive as well as cosmetic standpoint.
So flip it around. Why should someone not choose your specialty?
Why should someone not choose plastic surgery? If you're not good at being a psychiatrist, you shouldn't choose plastic surgery. Honestly,
really?
I'll tell you, we deal with a lot of different personalities on the cosmetic side for sure. But I don't just think that the cosmetic side is that way. The reconstructive side is that way too, right? Like we're helping people try to look and feel their best. And to be honest with you, if you're not really good at consoling and sitting and explaining and going through some of that aspect with patients, it can be a tough field for a lot of people. Like you really do. We jokingly say that we're psychiatrists with a knife, but to be honest with you, we really are. Like, and I don't mean just by the work that we do. I mean just from the aspect of you've got to really, really be able to talk to patients.
That is a really great answer that I wasn't expecting at all.
Yeah, for sure. It's there's a lot involved, with every specialty and being able to talk to patients, but I do feel like plastic surgery can specifically be very tough in that way.
Gotcha. So, fun question. Are there any stereotypes about your specialty?
Mine? No, there's none.
Plastics?
I think, one of the stereotypes that we have to fight a lot in battle is everyone thinks that we only care about money and it's all about the cosmetics and that's all there is to plastic surgery. It's all the glam and the glitz. And I think that's probably something we fight a lot because all you guys see is Hollywood and what's on Instagram and what's on all the social media stuff. And what's really important to understand is that there's so much more than that.
Gotcha. Well, next question is, are any of the stereotypes true?
Oh, I think for some people, the stereotypes are definitely true. I think you're going to always find in every specialty, there's people in your field who do play into that stereotype and all they really do care about is the money and all they really do care about is the glam and the glitz. And so I think there's definitely some people that live up to that, but that's not my way. That's not how I am. But I definitely think that there are people that play into that.
Gotcha. So I know you've probably gotten the chance to work with some students, some residents. What is your go-to answer or question to ask those students and residents when you're in the OR?
Oh, man. So I think for any surgeon, the answer to this question is anatomy. We are anatomists at our heart. That's what we love. It's what we do. So I think always, I tend to default to some type of an anatomy question for sure.
Oh, alrighty. Now, we all want to know, what does an average day for you look like as you're preparing for a case?
Oh, God. Okay, so what does the average day look like for me? So I usually get up around probably between 4 and 5. I always start my day out with a workout. I'm super into exercise and health and fitness. I'm one of those crazy CrossFitters, and I've been doing it for 8 years, and it's really enjoyable to me. And I love to start out my day exercising because whether I'm hitting clinic or whether I'm hitting surgery, I love just getting that sweat in early. And it just gets me charged up for the day because my energy levels are high. And it doesn't matter for me whether it's a clinic day or a surgery day. Either way, I tend to get up between 4 and 5 most of the time.
Gotcha. How many patients do you see on an average day?
I'll say it depends. So if I have a heavy consultation day, it might be like 8 to 10, maybe 12 patients with follow-ups, sometimes 15 or so.
So what's the most amount of patients you've ever seen in a day?
Oh, man.
This includes training, too.
Oh, it does?
Yes.
Oh, God. Early on in training, 30 or 40 easily, if not more. We used to see a ton of follow-ups.
Oh, what is the hardest procedure that you've ever done?
Oh, man. So I'll have to go back to residency for this one. So I trained in Nebraska, in Omaha. That's where I did plastic surgery training. And we did a lot of head and neck reconstruction. And so we dealt with a lot of tumors in the head, neck, and the jaw. And so I would say one of the hardest procedures we ever did was a free fibula flap, where the guy had half of his mandible taken out because he had a tumor and it grew into the floor of his mouth. And so you go down to the leg and you actually dissect out a skin paddle that's attached to the bone and has blood supply. And you then isolate a segment of the bone, and they actually do 3D scans before surgery to actually map out a 3D imaging of their jaw. And you actually isolate the fibula bone, you saw across the fibula, identify the arterial and the venous pedicle, clip across the pedicle, and take that bone and skin, and we make cuts in the bone and you plate it so that it exactly matches their jaw. And then for the soft tissue reconstruction, you actually suture the skin paddle into the floor of the mouth to where they took the tumor out, and you have to hook in the artery and the vein. And what made that really hard was this particular case, we used to do those all the time, but you send them to recovery and the vascular pedicle went down, so our anastomosis under the microscope went down. We lost tones, and so we had to take the guy back to try to revive it. We had to repeat that process 2 or 3 times. It just kept going down, and we didn't know why, but the pedicle kept clotting. We eventually saved it for that guy, but we spent probably, I think it was 18 or 20 hours trying to get that flap to live, which is crazy. So I'm going to head in here. You guys want to see what the OR looks like real quick before we answer a couple questions?
I'm sure the overwhelming answer would be yes.
Well, let's do it, man. So as they say, welcome to the theater. So this is where it all happens. We won't be using that. This is where it all happens. So this is a private surgery center. So obviously you always have to have your crash cart in here. It's a very small OR. This is where we keep all the sutures and all the things that we need during surgery. Anesthesia machine. They haven't turned this room. This room was turned over, but they haven't made the bed yet. So we'll make that soon. Back here, we keep a lot of storage of things that we just need. And then obviously for cosmetic procedures, we keep our breast implants in here, but it's a pretty small room. It's not as big as you might think it is, but this is where it all happens.
So I think a fitting question to ask in the middle of an OR is, what's the most common procedure you do?
So for me, I do a ton of breast surgery. It's not just cosmetic breast. I do a lot of breast cancer reconstruction. This is what we're preparing for this case. It's a breast augmentation, but I only do breast and body. I stopped doing face several years ago just because it didn't excite me as much as I like to do breast and body. So I'm heavily involved in breast cancer reconstruction and then breast and body cosmetic procedures for the most part.
Yeah. So what's the most memorable case you've encountered so far?
Oh, you know what? I have a really good case. This is a great story. So a couple of years ago, I saw a kid in my clinic who was getting bullied by the football team. He actually played football. 17-year-old kid? Yeah, 17-year-old kid. Gynecomastia case. So he had male enlargement of the breast. And so he came in to see me, and we talked about doing a gynecomastia procedure, which is basically liposuction of the chest. And then you actually have to make an incision around the nipple areolar complex in order to take out the gynecomastia tissue. You can't leave it behind. So unfortunately, insurance doesn't usually cover those cases. So we gave the family a quote, and then like a month went by, and I said to my MA, I was like, hey, whatever happened to that kid, man? Like, we never saw him back. And when this kid came to my clinic, literally couldn't look me in the face. Had a hat on, pulled down over his eyes, big guy, looking at the floor. She calls the family, and the mom's like, listen, we just can't afford it. Like, we really want to do it, and we can't afford it. So I felt bad. So I was like, you know what? Let's try to just knock the quote down. Let's just bill it as let's book it as like a liposuction case, and not even book it as like a more difficult case. So then like another couple months went by, and we called again, and the mom was like, we really want to do it. We just can't afford it. So I was like, man, this sucks. And I don't know what came over me, but I was like, you know what? I'm going to do this for free. Like, I'm not going to charge the kid. It just it really bothered me that the kid was so affected, so bullied so much that it affected like who he was. And I was like, what is the big deal? Like, I don't need to make another couple $1,000s. Like, I'm just going to help this kid. So I called the family, and I told the mom, I was like, I'm going to do it for free. I'm going to pay for the anesthesia. I'm going to pay for the facility. I'm going to donate my surgeon's fee, and we're just going to do this. And she was crying, elated. So the best part of the story is when I did the case here, when I came here, I told my anesthesiologist what I was doing, and she was like, well, I'm going to donate my fee for free too. And she's like, and you know what? We own the surgery center, so we're going to donate that for free too. And we did the case for the kid. Comes back to my clinic 2 months post-op, smiling, eyes showing, looking me in the face, totally happy, completely changed his kid's life. And I have to tell you, it's moments like that and cases like that in my profession for what I do that mean everything. So that's my most memorable case.
That's awesome. Well, I think I got to go the other end of the spectrum. Kind of, what is the toughest part of your job?
Oh man, plastic surgery. What is the toughest part of my job? This is probably not what you're going to expect, but being a guy who's in private practice, something they don't teach you guys in med school is how to run the business, right? Mm-hmm. So I've got the OR part down, I've got the surgery part down, and I would have to say that the hardest part for me is running the practice and managing employees and keeping people motivated and happy, for sure, by far.
Gotcha. Now, always ending on a positive note, what is the most rewarding part of your job?
The most rewarding part of my job, I have to say, is seeing people's lives change right in front of you, just from the procedures and the things that we do to help them regain confidence and feel good in their body again, whether it's cosmetic or reconstructive. By far, the happiest part of my job is when patients come back to the clinic, like with this kid, and I can visibly see how changed that they are.
Alrighty, now some quick fire questions about the lifestyle.
Yeah.
So, how many hours do you work in an average week?
Probably about 35 to 40 for me.
35 to 40?
Yeah.
Okay. And what time do you normally wake up? I know you talked about it for a little
Yeah, probably I said between 4 and 5, but usually probably around 4:30 is the most common time.
bit. Yeah. What time
Early.
do you normally leave, like the OR or clinic?
The good part about me being in private practice is for clinic, I try not to be there past 5 o'clock. I've got twin boys that are 12 and I try to be home for that. For the OR, I structure my day so I'm always done before 5 o'clock unless I have an emergency.
How many hours of sleep are you typically working on?
6, that's all I need.
How many hours of sleep are you working on right now?
6.
Do you have to take call?
I do not. It's random. But, when I first got out, it's interesting. I thought, man, I'm going to be taking call, trauma call, doing all this crazy stuff. And in our town, it was kind of a closed thing where like only 4 or 5 guys were on the call schedule. And if you tried to like go to the ER and take call, they wouldn't let you. So I built my practice doing Mohs reconstructions for skin cancer, people with holes in their face. So I've never had to take call since I've been out, which is crazy.
Yeah. Day or night person?
I think that's changed. So I used to be such a night owl. And like 2 or 3 years ago, I realized how important it was for me to get to bed earlier. And I'm usually in bed now that I have kids, probably 8:30, 9 p.m. easily.
Okay. And I love this question because it's a very underrated but important part of every physician's career.
Yeah.
How long does it take you to chart at the end of your day?
So something that's different about me, I am anal retentive about getting charting done. And I have had an electronic medical record system in my practice since day one. And I have to tell you, it's been a goal of mine and I've stayed true to it, is to get all of my charting done before the end of clinic. So I literally will get my notes done almost before I go in to see the next patient.
Okay. Now, wholesome question. Who are you most thankful for on your care team?
On my care team?
Yes.
Ooh. In my office?
Yeah, I'd say so.
Dude, I can't pick just one person. Everyone has such a huge role in the practice. So I definitely can't pick one person because everyone has their role.
Alrighty, that's a good, safe answer.
It's true though, man. I mean, you think about it, without an office manager, without the medical assistants, without the nursing staff, without everybody, nothing happens, right?
Yeah. All right. So you did a lot of surgeries in Chicago.
Yeah.
Right? Saw some crazy things. So what is the craziest thing you have ever seen in a patient chart? Without violating HIPAA.
In the chart?
Yes.
Oh, man. Like what they came in for or in
Yeah.
the chart?
Well, both. Either or.
So, easy. All right, I got you. You ready?
Yeah.
Okay, so I'll never forget when this was my last trauma case at Mount Sinai Hospital in Chicago. This was crazy. Last trauma that came in that I saw is this guy we think was trying to break into an apartment, and he was scaling the apartment building to get in. And he literally slipped and fell, and when he fell, that in big cities like New York and Chicago, they have the metal fences that surround apartment complexes and the spokes that go up. This guy fell and impaled himself on the fence, but it went up through his armpit and it came out just posterior to his clavicle. Chicago Fire Department cuts the gate. The guy comes in with the gate under his arm on the gurney. They wheel him into the OR, talking, no problem at all. We get a quick chest x-ray, no pneumothorax. Nothing's bleeding out of the wounds. We can't believe that this guy, nothing got injured. So we get all of his films cleared. We take him up to the OR. And you get him prepped and you get him ready because when you take it out, you're expecting some bleeding and something to happen. So we take the gate out, we pull out the rung, pull it straight out, slides out, no problem. Nothing's bleeding. And we're like, what in the hell? How is this guy, how does he not have a collapsed lung? And what ended up happening was the metal grate skived his rib cage, slid through the fascial planes of the rib cage, put a little bit of a rung in one of his 4th or 5th ribs, came out just posterior to the clavicle and missed all of the subclavian vessels. We pulled it out. He had no pneumothorax, went home the next day. Nuts. That was my last trauma case.
Probably used up all his luck in one night. Now, what is the most common medical advice you give to patients?
The most common advice that I give to who?
Your patients.
Oh, to my patients. What is the most common advice I give to my patients? I think probably one of the hardest things that I do is managing their expectations. So patients come in to see me, whether it's reconstructive or not, patients come in to see me and they have in their mind what they want to look like or what they're trying to achieve. If I can't manage what is reality and what they want, then it's really hard for them to be successful and have a good result.
Of course. And now you've also managed to find a way to merge your medical career with a budding creative field on social media. So how have you been able to find that balance between education and fun as a plastic surgeon?
Yeah, I got to tell you, I love to educate and I've always loved to educate. In the beginning, I think managing like TikTok and YouTube and Instagram and putting out good content was really hard. I didn't really know what I was doing. As the years kind of rolled through, I've just gotten good at creating content and planning it out. I mean, I have busy enough platforms right now that I have someone helping me, but I don't know, man. I'm a savant in that way. Like I wake up and it's go time. I have in my mind, things come to me. I'm like, I have like this motivational post that I want to make. I'll find a picture and I'll just post it. Or I'll pre-plan out a couple of posts that I put up over the next few days. But I will tell you, it is a tough balance. And there's no question, like if you don't love doing it, then you will never make it happen. But because I enjoy educating, doing a little comedy, doing a little inspiration, it just kind of is part of my workflow in the day. And between patients, I might run in and put some stuff on my Instagram stories or answer a question. And I just work it into my day, but it's definitely not easy.
Sure. So now we've talked a lot about your life as a surgeon. So how about your life when you clock out? So what is your favorite thing to do when you are not working?
Hands down, it's hanging out with my family, right? Like I have twin boys, they're 12 years old. They want nothing more than to hang out with dad. And so I think for me, my favorite thing to do at the end of my day is to kind of walk through the door, see their smiling faces. Because when you become a parent, you will realize that all the other things in life don't matter, that your sole job is to train and raise those children to be really good humans, to do good things. And so that's definitely my number one.
All right. Well, speaking of, how many kids do you have?
2, that's it. Twins,
2?
They're 12. Brody and Graham, they're awesome, man. They're the greatest kids ever. My boys are autistic, and their minds, they think in ways that none of us would ever consider thinking, and they see the world in a different way. And they have, without a doubt, made me a better person just by seeing the way that they think and the way they envision the world.
That's awesome. Now, does your family ever ask you for random medical advice?
All the time. Are you kidding me? People call me for, like, my mom called me yesterday. She's like, your dad's got a trigger finger. He's got to go have this done. And I'm like, oh God, I don't do hand anymore, Mom. Like, I can tell you what a trigger finger is and I know how to do it. But like, people always call with random medical advice. And my favorite is when someone calls you for like an OB question. And I'm like, I am not a gynecologist. Like, you're going to have to call your doctor for that one.
So, on that note, what's the weirdest question a family friend has ever asked you?
Oh God, the weirdest question a family member has ever asked me. About medicine?
Yes.
Oh man, I don't know. I'd have to think about that.
It's okay. Could be something random. Usually everyone's answer is some sort of skin condition. They'll send pictures of rashes and stuff.
Oh God, yeah. People send me that. Actually, I'll tell you. Pediatric rash. Without a doubt, I had a family member send me a picture like, do you know what this is on Sophie's arm? And I'm like, I have no idea. I'm like, I'm not a pediatrician. I don't know.
Oh, any pets?
I don't. I'm allergic. I'm one of those guys.
What's your favorite animal, not a dog or cat?
My favorite animal, not a dog or a cat. Ooh, sloth. I love sloths.
That's a unique choice. Haven't heard that one yet.
Have you ever seen a sloth?
Yes, they're terrifying.
They're awesome.
So, if you could have dinner with anyone in history, who would it be?
Oh, I always hate these questions. If I could have dinner with anyone in history, who would it be? You know, it would have been cool if I was even coherent and could talk at that point and have rational thoughts, but myself, like at a really young age. Like, you know, I have no memories before like 5. Wouldn't it be cool to have dinner with yourself at 5 just to see how you were and how you acted? I think that'd be cool. I would love to sit at a table with myself when I was like 5 years old and just see how I was. I think that'd be cool.
That's one of the best answers I've ever gotten. What would you guys be eating at that dinner? With that dinner with yourself?
Dude, mac and cheese all day and pizza.
Good
for
choice.
Sure.
What's your favorite dish to eat?
I'm a barbecue guy, so barbecue ribs, being from Georgia, boiled peanuts, barbecued ribs, cornbread, all the Southern Comfort stuff is my jam.
Yeah. Coffee, tea, or soda?
You know what? You're going to laugh. As a doctor, I don't drink coffee, not really a tea guy, health and fitness nut. I drink a lot of water.
Well,
I don't know. I've never been a coffee guy, and people are like, how do you not drink coffee?
Speaking of water, I love this question because every doctor gives me a different answer. How much water should you be drinking every day?
Oh God, here we go. So the routine answer is a gallon a day, right? Mm-hmm. So I drink a gallon a day, but I've been doing that for a really long time. It really matters how big you are as to how well hydrated you need to be. So the real medical answer to that question is you should be peeing clear, so that you're well hydrated.
That's a good answer.
Yeah.
Oh. Favorite meal from the hospital cafeteria when you were in training?
Oh, bro, when I was at Mount Sinai in Chicago, it was for sure cheeseburger and fries. You know, hospitals, what blows me away about hospitals, the most unhealthy, crappy food on planet Earth exists in a hospital. And I don't understand it, but for sure as a resident, I was a fries and cheeseburger guy all day. All day.
All right. Pineapple on pizza, yes or no?
Oh, God, for me, it's a heck no.
Alrighty. You're
Nope.
normal.
Do you like it?
No, I agree with you. You're
Yeah.
the normal ones.
I'm a hell no.
Any artistic hobbies you keep up with besides the video work?
Oh, can't draw to save my life. Any artistic hobbies for me? Surgery, I guess, if you want to call that a hobby. It's more of a profession. But I'm not really artistic, man. I mean, I guess I'm artistic minded, but I don't have any artistic things that I do.
Gotcha. All right. Favorite kind of music to listen to in the OR?
Country.
Country? Yeah. From Georgia.
I'm either country or like hip hop. I love hip hop type music.
Top 3 music artists for you?
Oh man, you are coming in hot.
These are supposed to be the easy questions.
Wow, listen to so much stuff. God, I love good old classic Garth Brooks. Garth is awesome, and you're gonna laugh, but dude, I love rap. Like not rap, but I love like hip hop type music. So like B.I.G. Love the Notorious B.I.G. That's up there for me. I love his music. And what would be a third one for me? How about some classic like Led Zeppelin? I love some of that old school Led Zeppelin music.
Those are all good choices.
Yeah.
Oh,
that's tough, dude. Come on.
Man.
Not prepared.
Wait for the next one.
Oh, God.
What's one song you think everyone should listen to before they die?
Wow. So what song lights my fire? How many people say Stairway to Heaven? That's not my answer.
I think I've only heard one person say that.
No, I don't think that would be my answer. Like what's a favorite song that I think everyone should hear, like that makes me feel happy? Oh man. It's got to be a happy song, right?
Doesn't have to be.
Stumped, bro.
First song at the top of your head. Without thinking. That's typically the one.
I know, because everyone's thinking about it.
Yeah.
You know what the funny thing is? The first thing that came to my head, Cry Me a River by Justin Timberlake.
All right, that's the
Cry
answer.
me a river.
That's the answer.
Like you're on your way out and it's like, cry me a river. Here we go.
Alrighty. One random task you wish you could be better at.
Drawing for sure. Drawing looks amazing. I really, really wish that I could draw. And I would maybe lump into that as singing a task or
Yes.
actually playing an instrument. I would, you know what? I take that back. Drawing would be amazing, but I've always wanted to be like a masterful guitar player. Like, I think that would be badass.
What is the best way that you relax after a long day?
Oh, man. So for me, the best way I relax after a long day, um, man, I love to chill out in the backyard at our house and just deal with like watching like back by the pool, hanging out, totally casual. It's really nice outside. That's what I love about it.
Okay. Night in or go out on the town kind of person?
Night in for sure, no doubt.
Uh, Indoors or outdoors?
Outdoors all day.
Beach or mountains?
Mountains.
Would you consider yourself more of an introvert or an extrovert?
Extrovert all the way.
And do you think that personality trait was a factor in you choosing your specialty?
I don't think so, because surgeons tend to be people who I would think would be more introverted and not like to talk to people. And I actually love talking to people.
All right. Well, we're getting close to the end, but these will be some more reflective, deeper questions.
Cool.
Okay. So, first one, what did you think you were going to be when you grew up as a kid?
Architect.
Architect.
Yep.
Nice.
I sort of am, I guess.
Yeah.
An architect of the body.
That's such a searching answer. Oh, is there a different specialty you think you could have done?
Yeah, for sure. I think interventional radiology would have been really cool. Like, I still love the technical handsy aspect, and I think IR would have been awesome.
Nice. Now, if you didn't do medicine, what do you think you'd be doing right now?
Something in health and fitness, no doubt. Because I think another thing that I'm passionate about is motivating people health and wellness wise to kind of just live that healthy lifestyle. So it'd be something in health and fitness for sure.
Yeah. Now, we talked about this earlier, and everybody that has pursued a field in medicine knows it is not easy at all.
Mm-hmm.
So, were there any times you doubted you would make it as a doctor?
Oh, yeah. Tons. I mean, I knew that I was going to make it through medical school, but there were definitely times, I mean, who doesn't have self-doubt? There's so many hoops you have to jump through that there were definitely times along the way that I questioned, like, God, am I going to get through these exams? Am I going to pass that board exam? But I think you just realize that that's just part of the game. And I never, ever, ever had a moment where I said I was going to quit. But I for sure had moments of discouragement where I thought, God, am I going to make it? Absolutely.
Mm-mm. Now, if you could change one thing about the medical field right now, what would it be?
Insurance. I think the insurance system has gravely ruined the ability to give care the way that we want to. I think it's made doctors do things that they wouldn't ordinarily do just so they can survive and make money.
This is a pretty common theme across all my interviews.
For sure.
Now, what can a medical student do right now to prepare to go into your specialty of plastic surgery?
Oh, so I answer this question all the time, and I tell med students this all the time. Your focus is to make good grades, do well, and as you're moving towards like that third and fourth year, you just really need to take a deep dive and reflect on what do you want your life to look like being in practice. I think that is really important and underlooked at. You really have to consider, what do you want your lifestyle to be? Do you want to be present more with your kids, or are you looking to be at work more? Is your goal money, or is your goal balance in life? And so what I would tell you is to heavily weigh those things, because it will play into the rest of your life. And get married, you have kids, and whether you do or don't have kids. And the other thing I think that's really important is consider finances in life, right? Like, not about making too much money or not making enough money, but where do you want to live? Do you want to live in a city that's going to require you to make more money? I think all those things are things that are real topics that you have to consider. At the end of the day, you have to go with your gut and whatever specialty you want. But if you're going to move towards plastic surgery, I will tell you this, do not do it for the money. People think that we're all rich, and we're not. I do it because I truly love it. I genuinely enjoy the cases that I do, the lives that I get to touch. And so if you're going to be a plastic surgeon, you better be doing it for the right reasons.
Great answer. Now, if you were to go back, Would you change any of your experiences that got you to where you are right now?
Definitely not. I bet you everyone says that. We'll all tell you that the things that led up to being where we are, the failures, the successes, got us to where we are, and I don't think I would change that for anything.
No, I don't think there's a single person that said otherwise.
Yeah.
Now, finally, question 73.
This is it.
Yep. What would you say to the aspiring plastic surgeon right now?
It's a great profession. I love what I do. Every single day, I genuinely mean that. Are there moments that are not pleasant and not fun? Absolutely. But I love what I do every day. I love the diversity of the field. I enjoy the impact that I get to make on cancer patients' lives and non-cancer patients' lives. And so I would have to tell you that if it's something that you think you're interested in, there are so many things you can do within the field, and I would pursue it and be awesome at it. Dedicate your life to being awesome at it.
Great words of advice, Dr. Brown. Thank you so much for your time. That is all I have for you.
My man, thank you.
And enjoy the case tomorrow.
I will, for sure.